Good evening, and good evening. This is yours truly, Dr. Luvuyo Bayeni, your host for Dr. B Talks, and indeed, it is another exciting episode from Dr. B Talks. And yes, we are excited to be back on in person. We have been having virtual sessions in the last two sessions that we've hosted. And we always appreciate you joining us on Dr. B Talks as well as Sowetan Simulcast Broadcasting. And we always remind you not to forget to share, invite, and have as many people follow us on our Facebook page as well as our YouTube channels. This is yours truly, Dr. Luvuyo Bayeni, and welcome to Dr. B Talks. This is now a new month. We are in the month of June, and in the South African calendar, obviously, it's a month that is commemorating youth. Especially the June 16, which is the Youth Day. And I know that most of you might have also followed that it is also a significant year as it is commemorating 50 years of that milestone. But of course, at Health, we always try and be relevant to the South African calendar, but also keeping in mind what is happening when it comes to the health calendar. So we are going to combine both for June and looking at how we can benefit and empower the youth, as well as making sure that we keep and we make sure we celebrate those events and calendar days as they appear. So today it is the 7th of June, and in terms of our international health calendar, we are commemorating what we refer to as our International Day of Cancer Survivors. And yes, in terms of the timing and the date of the day, it is always aligned to the first Sunday of June. And it so happens to fall on the 7th of June, which is our first episode for this month. But we've got some interesting lineups for the month of June. And yes, I think without wasting time, I want to take this opportunity to also indicate that today we then opted to open the month of the Youth Month with commemorating as well the International Day for Cancer Survivors. So I met this lady, and it so happens that I know the sister. It's a small world. At church, and we were having a moment in church, and what touched me was that she was expressing and sharing a testimony when it comes to her journey around cancers. So I then thought it is befitting to just not look any further when it comes to having someone to come and commemorate the day with, and especially falling exactly on a Sunday. Initially, I thought it may need to be a special broadcast on our part, but it so happens that it fell exactly on a Sunday. So that's why we opted to open the month with this topic. So, and I then invited and I asked her to be a guest here at Dr. B Talks. And outside church, this may happen to be her first platform where she is sharing outside church, outside family, and outside her health sector space. And we are honored and we do appreciate, as Dr. B Talks, that you had agreed to come and join. Welcome to Dr. B Talks, Sinazo, and it is really an honor for us for you to be here. And this is just a platform where we offer education, support, experiences when it comes to health issues and health topics. And we keep bring it live. So yes, it is not scripted, and you are more than free to express yourself and share with us as we go along. And let's also encourage and remind our viewers to not forget to drop on the comment section your experience, your questions, as well as any other issues that you would like us to touch on, as we see already that Kolisa is also indicating that they have joined, and we are excited that you are already part of the show. Sinazo, I would like to give you an opportunity to introduce yourself to our viewers of Dr. B Talks. Even before we come to the topic, just to share a bit who is Sinazo and how would you like to the audience and the viewers to know who Sinazo is.
Thank you so much for having me. Igama nguSinazo Nokoyo. Wasitabase. I am a last born to 4 sisters. We moved to Pretoria back in the day. As a profession, I work in the retail sector, in the banking sector, and I've been there for about 10 years now. And in my free time, obviously, there's church. I love to read. I love reading. I love music. And that's just about it.
Wow. Yes, I was worried that why not at church? People are going to think that this dude told us that you met at church. Where is the church not coming?
Why is it not there?
Actually, she's being polite. She's very active in church, and that we can say. Those of us who know and follow us in church. But yeah, thank you for that, and thanks for that intro. Yes, here we are, and I think for our audience as well, you are just expressing what we also try and achieve at DrBTalks, where when we started the platform, we would always say that for us, it's not about being in the healthcare space. For us, it's not about being a professional in health. For us, it's not about you understanding from an academic or a medical point of view health issues, but we are trying to bring a platform where we remind people that all of us are one way or the other affected with health issues, and we need to be able to understand and participate, whether it be by listening and sharing information, whether it is also by sharing your experience, or whether it is just about asking or commenting where there were issues of clarity that you would want to read. So you are expressing exactly that. At DrBTalks, we try and make sure that we are this flexible, vibrant platform that is here to bring and educate and bring information to our viewers. So thank you very much for that. Maybe again, let's start by, obviously this will be more on the journey that you have walked, but ours is also trying to have some element of awareness, have some element of lessons, and also have some elements of education in terms of the cancer space. And also, obviously, the day itself will embrace that you can purely focus on your journey because it's about commemorating survivors. And that's what we want to express here on our show today. So maybe just before we go any further, now you're standing here or you're sitting here as a cancer survivor. And I think there's a moment and the viewer is asking, but what happened the day? Or how did you come about to be even diagnosed? Or how did that process or that experience go for you? Of course, viewers would be like, she looks young. How did she survive? When was that? How long did it take? So just take us through to maybe expressing and sharing, obviously at your comfort as well. Take us to that day when you started maybe the journey of saying there's something wrong with me. I'm not sure what's happening. And up to when they say this is the diagnosis and what that journey was for you and how it could have went.
How I noted that there was something wrong. Okay, so let me start with this. I believe in doing annual checkup. I am for that once a year. I have that visit with my GP and I do my annuals, and I try to do them not so close to each other, like Bana, you stick to a certain date, Bana, on the 17th of November every year, I have my annual. So I try to be as random as possible. The first time I noted that there was something wrong. I think it was back in 2023.
Okay.
There had been smaller things, but I never took them into consideration. This could be it. But when I went, it was when I was going for my annual in 2023. And I said to my GP at the time, there's something wrong with my boob. Where those examinations that were taught about in high school, how to do your self-examination at home. I do those. And at the time it was a smaller lump right at the bottom of the boob. And I made mention of it. She did her examination, but also the reason why I mentioned it was because there was an inconsistency with the pain, and they were not the same size. It was slightly heavier, but it was nothing that I thought was alarming, but I just thought I'd mention it to her. And she did the same examination that we were taught to do in high school, and she wrote it off as it being nothing. So namda puma goyo. But in 2024, then the pain started coming, but they were not consistent. It would be 2 days, 3 days of a painful boob, and then the pain would go away. I remember I had flu and I went and I made mention of the breast. The pain is uncomfortable. It's not that I can't manage it, but it's uncomfortable. And again, she did the same examination and she dismissed it as it being nothing. I think it was when I went for my annual Gengungo 2024, and I said, Doc, there's something wrong here. There's something wrong with my boob. And she also, I had requested for her to do some bloods, and she said to me that certain bloods need for there to be a cause. She can't just request because the medical aid is not going to pay. And I said, okay, I don't have a problem, but please look at the boob. And she examined me and said to me that the first thing she said in Dogbanda was, oh no, it could be that when you're going through your period. And I said to her, it's not that. And the reason why I said that is because I was diagnosed with endometriosis. So because I was diagnosed with I'm on treatment for endometriosis, and that stopped my period. And I said to her, I don't go on my period because of 1, 2, 3. And then she says to me, oh no, it's probably just a gland. And I said, I hear you. I'm not disputing. But should breasts be painful? Is it a norm for breasts to be painful? And she said no. And she wrote me off, didn't listen to me. And it was at that point when I was being in big because I got my meal. And I felt gaslighted because now it was almost like I'm creating a problem when there's none. And I decided that I would then follow the pattern of the pain. And there was this thing, it was almost like a ringworm that would come here on the arm. It was itchy, it would come for a week or so and then disappear. And then it would come back. So there was that, and then there was the pain. So I decided that I'm just going to monitor them. And then because also, as you know, I can't just go to a specialist. I would then need a referral. So I then monitored the pain. In Jan 2025, it became a weekly thing. Towards the end of Jan, it became an everyday thing. Even at work, I've make mention that I'm in pain. And now the arm was painful, my back was painful, and the back pain at the back was almost like there was a bit of a hole that was opened, and the cold or the air was penetrating the bone. And at work, we checked it off as it being just fatigue. But I wouldn't take leave. Just take leave. You take leave of your pumla. But the pain was it was continuous. And I did not want to self-medicate because I did not know what I would be treating. And also I do not know what I was going to say when I get to Kliksinobana. I have a problem with the boob. I had this ringworm thing that I can't describe. So I decided that I think towards the end of Feb that I was going to go see my gynae. Because that was the one person that I trusted that was going to listen to me. My gynae has this theme, or this motto that he says he would rather over-treat than under-treat. So I went to him early March, and I said to him, I need someone to confirm and I'm not creating an illness when there's none. But this is the problem that I have. And he says to me, what did your GP say? And I said, well, I'm here talking to you as a gynae, not a GP, because I can mamelanga lama. And he was quick to put out a disclaimer to say, listen, this is not my forte. I don't know. I'm going to do what you did at home because I'm now using my first and second year teachings. Everything. And at that time now, the boob is very, very painful. Chisa, lebuhlungu. I can't. So. Yes, it's heavy, and I can't use my right arm. I couldn't even sleep on my right hand side. So he examines me. I think it's halfway, and I'm like, Doc, you're not pressing a sponge. I like making jokes. I genuinely like making jokes. So the guy's a sponge. He's on the pressure. And it was then that he says, I need to call and consult with a colleague. He consults with the colleague, and the colleague says, send that person to radiology as now. Don't make her leave. Let her go to radiology. And this all happened in Mediclinic Movement Hospital. And I went, and the figure got radiology. They gave me obviously that thing to complete the form. And I went through Banfagala Cape since we scanned so Kala. The doctor says, I'm not satisfied. They do a second scan.
Mm.
The doctor says, "Khona le nto I understand." Then they do a third one. Then she says, take it through for a mammogram.
Mm.
But now, age-wise and medical aids and mammograms, and there's a fight that ensues, the doctors and the medical aid. The medical aid says, can't you use the information that you have now? And the doctor says, if I had, I would have. I'm doing this mammogram and you're going to pay. And they try to play the age thing, but obviously my doctors were very stubborn, and we ended up doing the mammogram. So they do the first mammogram. Also, they lie. Mammograms are painful.
You see why we bring experience. Dr. B Talks on the column would have written, it's a painless, maybe with a bit of comfort, discomfort, but yeah. There you have it. And please pardon us. We always say patients are not textbooks, and it's always important for us to get an experience as well from the patients.
They don't warn you about the pain that you're going to experience. So if you've got this flat, you've got this. I had a bunny in makeup because you've got the flat and then you've got the top. And then they put your boob on this flat thing, and then the top part presses, and it's pressing on an already painful boob. To get whatever is the other one, and then they press it down, and they take whatever the images that they got there, and the doc says, no, I need another angle. Then the nurse comes
round two of the pain.
This is the round two of poking something that's already painful. And she keeps saying, I'm sorry, I'm so sorry, I'm so sorry. Like, just do it. I understand you're doing your job. And she does it. And again. And then the doctor says, can we do the left now? They do the left. And then she comes and says, I need to do the right. After now they've done the thing.
This is the third cycle now.
If mama for the fourth time that you are processing,
you must deal with what you have. You must just make up your mind.
It's not going to change anything. And she comes back to me and she says to me, I don't like what I see. I would like to do a biopsy. Now the time is about 3 o'clock.
Now, and this is the day that you thought you're just going to consult and you just want to ease lending at you.
You are overthinking things. And she says to me, I now need to do an emergency biopsy. It was past 3. And I said, okay. And says, I'm going to go fight with the medical aid again. But I know now that I'm going to send the request. And they were quick to respond with a decline. And they said they need a motivation for the biopsy. Again, the woman was very stubborn. And she says, come back tomorrow. Tomorrow we're doing this. They will approve.
Yeah.
So I go back the following day. And a biopsy, the way they say biopsy, you think it's something big, but it was just a tiny incision where they pull out a tissue-like white thing, and that was that. And then she says to me, the rest, the mammogram and the scans have been sent to your doctor, and you should go to him. He will fill you in. And I'm thinking, God will do. He's just a guy. What is he going to do? But I went, and he said to me that there's a doctor that I've referred you to. But because we're waiting for the biopsy results, I asked him to look at the images that we have,
what you've done,
so that we can, know
can have a sense.
Just in sense. And at that time, I had somewhat was like, in God, it is what it is. Whatever comes, I'll deal with.
Sort of an acceptance of some sort, like, as long as I know what's happening, but let me know.
Let me just know. There's something going on. So I go to him and he's, it's not looking good. I can't go into depth with it because it's not my specialty, but it's not looking good. And he says to me, as soon as your biopsy results are out, Dr. Maluleka will call you. I'm like, I'm on phone. And says why? And I'm like, let you enjoy Easter because it was towards Easter.
Okay.
Let you enjoy Easter. Come down and do cons. Be right. And he says to me, so this is urgent. I'm like, Doc, for me to come to you, I know. But it's been sitting here undetected. I can't go in a week. Zababona after my Easter. And I went after my Easter. Kwave was pity from there. The results came back. And Dr. Maluleka Wakona, he had my scans. And he had a scan of another patient. And he started his explanation with the scan of another patient and said, this is a breast. And this is what we would, as medical doctors, refer to a healthy breast. And there was dots on the breast, but they were not prominent. And then when Genesini scan, and they were just in tiny dots, just white particles on it. I mean, it's black and white, so you can quite see that prominent. And it says, this is yours. And I was like, oh, okay. He didn't have to spell it out.
You could compare from the other.
Compared. And then he says to me, I'm sorry, but you have breast cancer. And I'm like, oh, okay, what next?
Of course, now this is because of the 2 years that you had undergone, well, for the lack of a better word, on your own, because you kept on coming to a general practitioner and you kept on raising issues and they were not attended to. So, and I think by that time when they were giving you that, so like, on one end, it's probably a relief to say now the 2-year uncertainty is now getting sort of.
I know now,
but also you seem to be sitting in a risk of not making sense of what does this mean when they say you've got cancer, and you're like, let's move on and let's go there.
He said, I'm sorry, but you have breast cancer. And I was like, oh, okay, doc. What then? And then he says, the good news. And this is something that I took and I ran with. He said to me, based on what we have, the cancer has not spread. That was my starting point when I delivered the news, even to my family.
Okay.
He says to me, the cancer has not spread. It's showing that it's sitting in. Okay, yes, one of the medical teams, the nasal code, he was using a whole lot of codes. And I was like, Doc,
simplify it, get to my level, please.
As a 5-year-old, and explain it to me. And Goshen, he did that. And he says to me, looking on these scans and your biopsy results and your mammogram, the cancer is still in one place. And from what I can tell, we will just have to do a small incision, remove. And that will determine whether we go to chemo and radiology and all of that. And then he says to me, but this is not my field. I'm going to have to refer you back to, I'm going to have to find somebody.
You move from a tennis court to a netball court to everyone is saying it's not my field, my field, my field.
Really? That's all it's for. And also, let us not forget the financial implications of that comes with this diagnosis. So then he refers me to somebody else. And Nayelona does his own biopsy, does his own mammogram, forth. Now, I was like, I took the first one, I was like, it is what it is. Nothing that they do now is going to change the outcome of my. And Loana, that's the last time, because that trouble.
Yeah, well, we can tell already, but no, you represent yourself.
He's talking, and then he says to me, and then he says, your cancer. I'm like, no, did this woman just say your cancer?
Is it now personalizing it into society? It's like now, here, boom, it's yours.
He didn't say that. And then he continues. I'm like, dog, I hear you. I'm not in disbelief. You're not the first person to say this to me, but this is not my cancer. You can say And then he says to me, I hear you, but your cancer. And I'm like, dog, this is not mine. Because if it was mine, one, I would have known. Number two, I can't give it to you. Can I give it to you? Can you take it from me?
If it's mine,
if it's mine,
even if it's anyway here, I can then say, can't let this.
And I said to him, I'm not telling you how to do your job, but you are dealing with people, and as people, we tend to overthink. And deliver. I'm not saying be compassionately lanam, but have a way in which you deliver things. I don't have cancer. It's not my cancer, but I have been diagnosed with. When you put it that way, it's somewhat easier to digest. There's the diagnosis, and now you can. I mean, who wants to have something that kills people as their own?
Up. In the viewership, we have healthcare workers and advocates of health and managers of health, and I think you in your journey you have also been expressing one thing that I hope my colleagues would not take offense when we say this is a lesson, guys. Clinical medicine, it's about reminding you of understanding that there is a human being behind what you were taught at school. I recall that I was interviewed in one session, and when I was asked about my journey at school, I said one of the things I took from one of my professors, and of course I'll always refer to him with name, because my colleagues will always say, Professor Wayekwata, Professor Munukwana. Whenever you answer questions, you would be so correct, answer academic questions. He says, no, nonsense. And then when he gets to someone who says, I will counsel the patient, then he would say, exactly. And he would go back and say, that's where you start. Then you can come with these investigations, this imaging, all these fancy things, but put the patient first. And your journey is expressing and reminding us as healthcare workers that it is always important to not be ahead of your patient, walk with your patient. And now you've also mentioned something very fundamental in terms of, you even express it well to say the delivery of the message. The message might be correct, but the manner in which the message is delivered, it can be a problem. And of course, the messenger can be a problem as well. So we must be careful that we could be so genuinely correct and maybe not meaning any harm when it comes to the message. But I think the lesson you are bringing today is let's be cautious, let's be careful of who the messenger is and how the message is delivered, so that at least it does not make a distance and creates a wall like you have expressed. No, thank you very much for that. And yeah, we are being humbled as healthcare workers, and we do take note and the lessons as well. Yes, you can continue now. You agreed with your doctor, but it is not my cancer. I accept that I am diagnosed with cancer.
And then I was referred to the final surgeon. But the reason why he referred me to the lady was because he said that she specifically deals with breast cancer and she studied it. But there was a side note that he wrote to to the surgeon to say, Kutubana, he thinks that I should be taken to for a psych evaluation. He does not think that I received.
Comprehend. Okay.
He does not think that I received the diagnosis very well. And kudos to my doctor, because she saw the side note and said to me, Bana, they're saying that I must do 1, 2, 3. And I was like, oh, out of the whole conversation, that's what we chose to take here. Because all I did was challenge his delivery. And she chuckled and said to me, obviously, I'm not going to repeat what has been told to you, but I will need to re-examine you myself, meaning we're going back again to the biopsies and the whatnot. But before, she said to me, before we start, I want you to know this, going into this journey, it's mind over matter. And I said, sure.
Now she talks your language. She talks your language now.
And she said, it's mind over matter. You can beat it and you will beat it, but get your mind right. And I was like, okay, cool. From there, it was one specialist after the other. So with her final examination and final decision, when she examined the breast, she discovered it was already damaged. So we moved from that small little
the one that
it's a full mastectomy. They can't save
the right breast.
The right breast. It's funegile and belong. And I said, okay. And then she says to me, because of your age and you're very young, I would like you to see a reconstructive surgeon. And they will give you
what options, will be the options
that you want. But you going plain and bare is not something that I would advise. I've been sitting like, doc, listen, I was going to road dog it, but I choose life. So I wasn't going to cry over one boob. I'm not saying it was not important, but I wasn't going to cry over something that potentially could save my life, which was going to save my life. So I prayed prior to all of this. So my prayer life and my faith carried and sustained me. And also maybe going back, I already knew that something was wrong. And I will say this to anyone who's going through something: your body does not lie. You know your body better than anyone. And doctors can be wrong. They are human. But do not allow anyone to tell you otherwise. When you have a gut feeling that there's something not right with your body, go to as many doctors as you can. You will find one who will listen to you. But don't be so quick to write off just because it will.
Okay.
I'm not trying to bash anyone. We are all human. We are not immune to making mistakes. So I genuinely believed in me that there was something wrong.
Yes.
When I got the diagnosis, it was just a confirmation of something that, even though I could not name, I knew was not right.
And obviously that is also based on one. We did speak on DrBTalks about the importance of screening. And my viewers are still supposed to tell me if they've taken the exercise to go and screen. Because that day when we spoke about it, it was embarrassing that we have not been regular with our screening. So that's one thing that you also say you did. But I think of note, especially on the message where you are saying we should also understand that our bodies might not lie to us, is that you, apart from the screening, you knew yourself, or you knew your body.
Yes.
And you also took time to observe, because you did not jump just out of one day of pain, one day of a lump or some discomfort. You then went on to say, let me observe. And you were able to, even from an objective point of view, to even measure the pain, but the intensity is increasing. The character of the pain is now even radiating or moving to other parts. And you knew this means that there is something wrong with my body. So I just want to acknowledge and appreciate, and also maybe remind the viewers out there that to say, when we say represent yourself or do speak up for what you know about your body, equally so it comes with that responsibility of saying you would have also gone through these things. You have observed, you know yourself, you've done self-testing, and you can see there's a change, there's a difference, it's growing, it's getting more painful. So express yourself, and please make sure that you do understand that there is no harm in second, third, and fourth opinion. And also, it's not meant to offend anyone, especially, like we say, when you can tell that you have observed that there is something wrong with your body, and you know that you have been managing yourself, and there are things that you have put up to be different or progressive in the process. You may continue. Interesting, and thanks. Healthcare workers, yes, we are also learning. It's our session.
So the surgeon then starts all over again. We do all of the mammograms, but now there's a team that is being introduced. It was the plastic surgeon and the oncologist. I remember making a joke saying, financial planners, and I have an oncologist.
So now you're like, I know, let's be positive about this thing. In my life who are thinking about me, who are worried about me.
And I met with the oncologist, and she then explained that she can't do anything until they know what they're dealing with. And one of the first things that she did was she wanted to trace. Even with the surgeon, they wanted to trace the history. Breast cancer is
okay.
I did not know that in my family we have a cancer gene. Through questioning and asking family members, mostly my sister, my older sister, she was able to provide certain answers and things that I was able then to tell the doctor. I will say this, in the Black culture specifically, asikho isigulo somlungu in this day and age. This concept of hiding dangerous genetic illnesses that can harm generations is becoming a problem to us, because somebody passes away in the family, Kanti has been sitting with something that could have, one, gotten help, but two, to help inform the family members. We have this thing in the family. The more we know, the better. So I got that. The second thing that as I was educated, as they were trying to trace, and again it differs from person to person, but my diagnosis came around to the fact that, one, family history and having the cancer gene. The one that shocked me was that I did not have children. And when they explained it, they said that people who have children, women who have children at earlier age, and those ages are 35 and below, decrease their chances of breast cancer. If you have a child at a later stage, you can, yes, you can get breast cancer. It can contribute to you getting breast cancer. Something about estrogen. I don't have children. And the third one that also surprised me was that my periods, I had my periods quite early. Yes. I had my periods quite early on in life. Again, this goes back to the estrogen also. So those are the things that, apart from having you can have the cancer gene in the family and still not have the cancer. But now, if you have the other risk factors, then it takes your chances from a 40% to 80%. So it increases. So those were the things that I learned that I did not know. Then we meet with the oncologist, and she says to me, I will only come in once you've had the mastectomy, because then they're going to take their piece, take you to the lab and all of those things. And then I met Dr. Boobies. I call him Dr. Boobies, my plastic surgeon. And again, he took me through the process of what he was going to do. The different options. Yes, how he features into this whole thing. I thought when you get your diagnosis, from there you get your diagnosis and then, you're in Kinto. But they were so thorough that I only had my operation in July. So I said in March, April, May. So I said with 2.5 months with this pain. And now they can't prescribe anything. They give you paracetamol. They can't give you anything else. You have to sit on paracetamol. That was one. The second one, I had to go off my chronic medication for endometriosis, because they could not prove or unprove that it was also contributing. The interaction, So I had to go off on that. We went through with the journey with the doctor's appointments, and I remember I only disclosed at work in June, because now I'm spending more time out of work. And then I disclosed, and they were nice. They were nice about it. I had my mastectomy in July. And I remember asking Dr. Kritzinger, who was the plastic surgeon, how long is the whole procedure going to take? And he said to me, 6 hours. And I remember complaining, not really complaining. I remember saying to my colleague, imagine being out for 6 hours. I have no control over my body. And these people are just standing over me. What if I come back with a missing body part? It was just a joke. But I went in. They lied. It wasn't 6 hours. I went to hospital, and I was there at 5. Went in Tuesday at 5:30. Came out about 2:4. Yes. when I
It was a full day's work.
It was a full day's work. That's
how important you were. It was a full day's work.
No one did anything. And I got out and I was taken to high care. Now, when you have such things, there are things that work, or rather, there are things that you don't want to work against you. I have endometriosis. I was diagnosed with fibroids. I've had operations. I suffer from iron deficiency. That's not something you want to have when you go for such things. I learned. Also, I appreciate. I think it was in that moment that I appreciated that I was also a religious blood donor. I appreciate it. As a religious blood donor,
you bumped the list.
The only thing is they didn't give me free blood. They still charged me. But we went through that. I think I stayed in hospital for after the operation. I think it was 5 days or so, where I no kakashem kakabam I no I don't want to say I was a difficult patient. I don't take things seriously. I didn't, because I remember coming to, I think 2 days after the op, and in one of the vineyards I'm saying, there's a nurse. What are you doing? I'm just kidding here. I'm just kidding. What is that that you call? What do you call that process? Bath. It's not really bathing, but and I'm like, Sisi, was when the baths are luma. And all
please give me my space now. Please.
And she says to me, I need to do this. And it came in the valley and says, yes,
I'll do it myself.
I'll do more than anything. I think there are things that will confirm and for me that was one of those.
I've just come for the procedure and
so give me that. I'll clean myself. Even I said what it was that I genuinely do not appreciate it. It would have taken away my power, and that's the only thing I have.
Just before we proceed, looking back now, you made mention of a multidisciplinary team. So you had a team with you.
Yes.
But also you made mention, and with appreciation, of course, the issue and the value in what we refer to as informed consent. You even said you had to wait for about 2.5 because there was to and fro in terms of information exchange. You also wanted to go and get verification of some information and all that. In hindsight, what would you say was the value add of one, that appreciation, but not one person or one doctor can deal with the issue, but two, that opportunity for you to be well informed before we proceed, especially with the surgical intervention of going to theater. Because I think it's one thing that we would like our viewers as well to have a sense of and appreciate and understand, but also it's a lesson as well that I want to come out for us as healthcare workers and the healthcare system managers, that sometimes it's not about wanting to rush to do the action or to do the intervention. Put the patient first, give time, allow these things to take place. So what would you say was a value add in terms of that process of the time, as well as you even come out and say, now some of the things you didn't know, but now you know better, and it helped you?
The first one would be that Dr. Ngobo would say, I'm giving you a homework, go find out. If I did not have an answer for it, she'd say, go find out. And she's a very strict, straightforward lady. So when she gives you a fact, but she would support that fact with something else. And I remember even asking her, okay, we know what the problem is. Can you send Galuk? And she said to me that we have a team. I don't work alone. I work with a team. There is going to be a team that's assigned to your case, and we will discuss it. There will be a group of doctors with the nurses, and they discussed the operation, they discussed the pre and the post, and the best way then to tackle. So it wasn't just her saying, I'm the lead surgeon, I'm going to make all the decisions, but there were other teams at play that assisted and ensured that, for lack of a better word, I don't come back. Meaning, when I say I don't come back, they do just a once-off thing, yes. And so I appreciated that they were taking the time. Yes, I wanted it done, I wanted it gone, but they were not just treating it as a stat. Because one of the reasons, I think one of the things the jokes that I like making to them, because the oncologist had mentioned that I'm going to go into an oncology register. The hospital would register me, they would do anything. Yes. And I said, oh, look at me being part of a stat.
Now being in the register.
I'm in the register, and not only that, I am part of the stat, and the part of the stat that survives. Because, guys, I fight to win. I don't fight, but when I do, I fight to win. So they made the process seamless, and Dr. Ngobo always emphasized, I don't want you to worry about anything. Focus.
That positive mind, that thing that you started with, yes. It's about the mind game.
And I think even when I broke it to my friends, some of my friends did not even believe me because of how I would say things and make jokes about it. So they made the whole process rather comfortable. It was an uncomfortable situation, but they made it comfortable somehow. And they didn't take my questioning as me questioning the ability to do the job. When I said I don't understand, please dumb it down, they dumbed it down. When I said no to this, they would say, okay, let's try another thing. They did not shut my voice. They did not try to put me down. They did not try to belittle me to say, hey, we've been doing this for a long time. You're not the first patient and not. Because one of the things they always emphasize is that it always is, this journey differs from person to person. It's not a one size fits all. So what works for you, what is comfortable for you, we will follow you. As much as we are doctors, we will follow you. You say yes, we do. You say no, we don't do. So they made the whole process bearable. They made it comfortable, as bad as it was, but it was not the worst. Yes.
Beautiful. There you go. And thank you once more. It's an interesting journey in terms of how you are able to look at it holistically, both putting yourself in the center, but equally appreciating and narrating what you had observed about what was happening around you at the time. Yes, you are still on DrBTalks, and this is yours truly, the host, Dr. Luvuyo Bayeni, with our guest today, Sinazo, and we are reflecting and participating in the commemoration of the International Cancer Survivors Day, which is today, the 7th of June. But importantly as well, we are part of commemorating the June month, which is the Youth Month, and we are bringing you topics for this month that will help empower and equip our young people when it comes to health issues. So those who've just tuned in, thank you very much for joining, and please feel free to continue to drop your comments, and we've been seeing some of the emojis. And yes, actually, if you're still here, still with us, please put on those hearts, put on those thumbs. Let's continue to be part of the conversation. Wow, this is the part that I am not always comfortable with. It is 48 minutes into the show, and Bonnie is also commenting there in very interesting journey. So proud of her. Thank you very much, Bonnie, for that. Now, as we're trying to time is a problem. It's DrBTalks, all right. As now we're trying to come back, we've now fast forwarded and we've done the op, and yes, now you are in your mind saying one part is sorted, which is now the surgical part, and fortunately you're already empowered, equipped, and knowledgeable as to the next steps, including the journey and the conversation you've had with your plastic surgeon already. Then what happens?
So I was discharged, went home, I started chemo.
This is now July 2025.
Yes.
Okay.
We start chemo on the 18th of August, the day before I had my scars revealed to me for the very first time. And I remember looking at them, they looked ugly, they were red, they were, but I didn't have time to process, because in my mind, I was gearing up for the following day. And I remember going to my doctor. They give you a booklet, Payan, that contains all your chemo, what side effects that I did not read. I did not read it. So we go, and she says to me the day, because I had to go the day before for preparations, and she says to me, bring all the things that you would usually bring, or all the things that you do at home. Just bring your a totem bag with all your comfortable goodies and whatnot. I'm thinking, "Lo, Mama, these are little bag.
More comfortable goodies."
Little did I know. I got there. We got there in the morning. We have to do bloods for every. So my chemo was going to be every 3 weeks. So you go in, you do bloods, they do your vitals. Then she goes in, I go into the oncologist, and she tells me, Obana, we're going to start chemo. Oh, she first gave me feedback on the operation that they were able to remove, and they're happy with the outcome. But now she explained the process of why going into chemo. And she said that she would advise, please note, she said advise that I go into chemo so that it kills whatever remaining cell. But she said, I don't have to. This is something that where you get now, people are diagnosed and they do whatever operations that they do, but then don't
continue to
for chemo or radiation because the doctors advise. They don't tell you that you need it. They say we advise for these reasons. But at the end of the day, the choice to take or not do chemo is entirely up to you. And she emphasized this to me, Sebana, take your time, decide. And I was like, no, let's do this. Don't want this thing coming back. Let's do this. So I wanted people to know that they don't force you into, but they do advise not for you to go against it. But if you do decide to, it's still up to you. So we go in on the 18th. Setting up, it's very cozy. It takes about 24 people, if I'm not mistaken.
There's a couch.
Recliner chairs.
Yes.
The recliners. So I go in and she says to me, we're going to start your journey. One of the things that she said to me is that people will experience guaranteed hair loss within the first treatment. I was like, okay, cool. I went and I said, I don't know what in my mind I thought chemo was, but with drips, for lack of a better word. Zonke itwe. And I'm like, right. Cool. I have a port because my veins were problematic. So they had to insert a port. Unfortunately, I can't show them, but it's right here. It's a small little rubbery thing that they insert. So they then, for them to administer, when they administer, they have to squeeze and stab that needle thing. So I experienced that pain for the first time. And I realized that was going to be my journey as well. It was something that I needed to also adjust to. But I will never forget the first drop of blood treatment. They first give you a flash that makes you urinate a lot. And I was like, Doc, guys, like, nurse, sorry, am I supposed to be peeing a lot? And they're like, no, it's working, it's a flash. So they prep the body, and I remember saying to Nurse Annalise, how ironic, you're cleaning me for toxins to come in. But okay, right, so right, let's clean.
Let's not add on those.
What can we say? And I had, I think there's the tubes, they have about 250 mils, it was like then there were about 4 of them, and then also figure 1.5 were tripping back. And I don't know, Mnaki is consoler because it was covered. I was like, abafuni bana sibono bana ube anxious one year phela nini lento. I remember my sister my sister picking me up, and she said to me, "How does it?" And I said, "I smell like medicine from the inside."
You were pumped all this.
But I was still energetic with like, oh, I can do this, Little did I know. Following when I left, after treatment, you go in, go eat or whatever, you see the doctor, and the rest of the day, treatment is 7 hours. 7 hours of just you ingesting toxins. And then when you leave, they give you pills for nausea, pills for dizziness. But the one that they give you for sure, Leonos that you ingested before they give you the medication, and then they'll give you prescriptions for the others because you have to buy them for yourself. And I was like, oh, I can do this. This was me now, past 4 going home. But I was already feeling tired. The day went about. Day one was sick. Day one was sick. They went so. This is your bed, but you are facing down because you don't know if the vomit is really going to come out.
Or it's just some.
Or it's just just a nausea, and then you're battling that. You're battling dizziness, and they give you. There's a number that they give you, the clinic, mobile clinic, for any questions, for any symptoms, just for anything outside what you are going through. And they caution against the things that you need to look out for. If you are vomiting,
just for preps.
If you're vomiting, please call. And when you vomit, they will ask you what type of vomit is it. Can you bottle it up and bring it so that when they so that they can run their tests. Fortunately, I did not, because also they said that vomit is also, for you, vomiting is a sign of your body rejecting. So I did not have that, thank God. But everything, I cannot tell you what chemo does to your body, but it does a lot. It's almost like you have a little power, but you have something alive that's just chowing at your walls, your inner walls. And they would say, please take painkillers. But what am I taking a painkiller for? Because the whole body is in pain, internally and externally. And there's the tiredness. I think the worst one, okay, it's not the worst, but being tired constantly was a problem. You have things that my mind, in fact, battled, because brushing my teeth should not take me an hour, but it takes me an hour. A trip to the loo takes you an hour. You are walking, and my sister was always just like a step behind, because she doesn't want it to be too much.
So it's another hour for her.
She doesn't want to be too much, but she's just quite literally, if you need a help, I'm just here. So she tries to pace herself, giving me room, and then she'd say, "There's nothing." And in my mind, I can do these things. I can do these things. I don't understand. So first, it took the first treatment took full 10 days for me to recover.
Okay.
And when I say full 10 days for me to recover, I'm talking about eating, being able to sleep, and
just your basic,
your very, very basic kind of things to do. And then I had deluded myself into thinking that I could work and do chemo at the same time. I had deluded, because I remember fighting with my HR.
I'm not going to take time off. I'm not incapacitated.
And she said to me, and I remember, because my first treatment was on the 18th. Get one September. Oh, whatever. Yes, I was back at work. And the Friday, she said, I remember the following week, on the Tuesday, I was going for treatment again. And said, I don't want to see you here again. But I can say less, man, because and at the slightest 10 dizziness and the nausea, and you would think those would be the only symptoms that you have. Second dose, yafika. Tripled me. I remember, I think it was the second dose. I was telling my friend, and I cried. I was in pain. I was in pain. And
wow.
The second dose came with new side effects. I respect people who suffer from insomnia. You don't sleep for 2 hours, or you don't sleep for that night. Like, try not sleeping for 5 days.
You're supposed to be sleeping, but the call is
and you're in pain. And I was always fighting with my doctors because there's like, we can give you sleeping tablets, and I said I do not want to inherit an addiction after this. I'm not taking sleeping tablets. My body will learn to adjust. My mind will learn to control my body. I'm not using pills.
And that took about 5 days for you.
Yeah. So all of this, there was a lot. There was a lot of things that I experienced that I cannot really put into words, but it still would not say it's something that somebody needs to experience. Nobody needs to experience that. But a great support system, family, my friends, and my medical team. They were the best.
Yeah.
And if I had to say, to beat this, you need that. You really do. But also you need to get your mind in a space where you don't allow what you think you know about the disease to lead you. I did not read anything. I did not go online to check the stats of surviving.
You were just relying on what the team is also sharing with you.
I said to my doctor that I want to go into it blind. And even with my sisters, I'm going to go into it blind. I'm not going to read. Because again, as they said, it's different from person to person.
Yeah, that's
so true. Some of the symptoms that I would be showing, another person will not. So it made no sense for me to take other people's symptoms and make them mine, or vice versa. So another thing that I learned is this: when you get the diagnosis, people treat cancer diagnosis as how we used to treat HIV and AIDS diagnosis, where you think it's the end of the world. No one gets a diagnosis today and dies today. It's a prolonged thing. It doesn't. If you get a diagnosis today and they say that you have 3 days or 4 days to live, or it's something that you have sat on and ignored
for a while. For a while.
But you don't get a diagnosis today and die tomorrow. And I take Lando, guys. Yes, but I take. We can't be defeated by something that does not speak. Get your. It will sound very rude of me to say get your mind in a right space. Mine was the fact that they said it has not spread. And I said, even to my sisters, for as long as the doctors are saying there's nothing more we can do, I still stand a chance. I still can stand a chance, and I will win, and I will be. Even with my doctors, I would when Dr. Kempen would say to me, Sinazo, chemo is going to eat away at your flesh. Doc, this thing is only going to get 5 kgs from me because I need to lose 5 kilos.
It's gonna help me. I'm trying. It's helping me with my weight program.
And then whenever I went for my treatment, my body went. It was always on the, because my original weight when I went into it, I was 78. So it was always 73, 72, 73. Now you watch towards the end, but do you remember what you said to me? I said, what? I said, it's going to. 6 is generosity, but I was willing to give it 5.
Give and take.
Yeah. 5. I wasn't to mind anything else. And when I pray to God, I'd say, God, you're not going to make me look like my problems.
Oh yeah.
I'm not going to go out there and look like a person who's dying from cancer. I'm not dying, and I'm not going to look like it. And I refused. So those are the things that helped me. Again, shout outs to my family and to my friends. and my medical. At no point did they treat me like a patient. At no point did they and whatnot. And there were also things that I learned to treat the system, because I think after the second treatment, I saw good one. I take 10 days to recover. So for me to look forward to the thing, to also to my healing, I would then find those good days where I can eat, and I would eat everything.
So you make up for the other.
And it also gave me that thing. And when I'm going through it in the 10 days, I look forward to
the other breathing break day.
That break. Although, it's 3 weeks. So I am that 2 weeks. And then I have that 1 week to myself. And can the abuse addiction.
No, thank you very much. There's one part that I still want us to quickly go on. Thank you very much for tuning in. And yes, we are now still at DrBTalks. We have been on for my team is gonna kill me. An hour, but we will be concluding soon. But I just want to appreciate that one of the issues that we would have wanted to touch on is on how you would or what would you say to someone who have just gotten a diagnosis, and you've touched on that. Your strength or your message or what you would like to impact on people is, you said, the issue of the mindset. Make sure that you condition your mind, and I think you were practical to say, even identify the thin lines, the positives in whatever is presented. Find that positive. You mentioned that they said it has not spread. You're like, good, I'm going with that. They said it might take your weight. You said, good, I want a weight loss. So I think that's already. And I think the second thing you mentioned as well was the issue of the support, both from the family circle, but you also mentioned the relationship and the support from the medical team, but also your own motivation and your spiritual growth in your case, and also helped in terms of that space. So we appreciate that. Then the other issue that I wanted us to touch on before we go for our closing remarks, because I also want to say, if you were then to say, if I'm just going to summarize and look at what would have been my toughest point in this journey when I look back, where would you say it was?
Post chemo.
Post chemo was the area where it was the toughest.
Towards the end, actually, because that's when my immune crashed and whatnot. That's a story for another day. But post chemo, you would think it's done. You are going on remission. But they do warn against the pains. But I now have joint pain. I have pins and needles on my hands and feet. The dizzy spells have not gone away, and my body does not reflect that. I guess the trauma in itself, the body has not healed from the trauma. So certain things trigger the body. For example, there's is run as a cooling gel. And my hands. My sister would massage me with that. It would trick the brain to focus on that sensation. Yes, it would trick the brain so that I don't focus on the actual pain that I'm going through. So that helped. But now post chemo, I think the pains were too severe, and I asked my sister to rub me. The smell of it just took me back to the hardcore days, and I genuinely cried, and I said, I hate the smell of this thing. And says to me, we can stop. And I said, no, I don't want
to work on it.
I don't want the trigger to be that to take over. So post chemo is hard, because I think my hands cannot
grasp as much.
Yes. So I think but so inward. So I have to gently, open them up. My feet as well. I walk like a child who's learning how to walk, because the pains are severe. The tiredness has not left. I had a emotional support coordinators. Shout out to sister Latiwe Kubeka and Amanda Cameron from Life Hospital. They were my coordinators, and whenever I had issues, I would call them. And she said to me, but I must get myself multivitamins from Centrum. Those are going to be my life, or my best friend's called my life. So post chemo adjusting to the new body is new, but again, it hit Lendo, guys. And to anyone who's getting a diagnosis, it's not the end of the find your rainbow. It's there.
Oh, lovely.
Find your rainbow.
Lovely.
It's there.
Wow. Thank you very much for that. And but I think you also would not have done justice if you don't share with the viewers the day that now you confirmed and you signed off on the register of survivors. Because yes, that time when they said we're gonna see you after the surgery, you said I'm entering the register. Now, when you confirmed that, hi, I'm saying it exactly. When you said, I told you so. Yes, let's just share with our viewers, and then we'll be wrapping up.
I want you to remember, I said in the beginning, towards Easter 2020.
Yes.
It ended on the 30th of March. That marked what? A Holy Week. Call me whatever you want. I believe that God is a holistic God. He does. So I received that last day on the 30th of March 2026, and I was like, yeah. The whole hospital could not. I was making noise. I called whoever I needed to call. I made noise. I made noise in the hospital hallway. And shout out again to Life from Clove nurses, because they were there and they were celebrating with me. But that was me ending chemo. I was going to Herceptin. Herceptin is like a flash. Now you get in a side effects, but we don't want to talk about those. We're going to celebrate the good. It was on the 30th of March.
2026. There you have it. Now we have brought you a cancer survivor. If you might have missed and joined late, specifically it was breast cancer. And she had undergone the processes of diagnosis and went as far as before we missed this one. There is a comment there that says, thank you very much for your incredible strength and courage in your fight against cancer. Your resilience is truly inspiring. And the way you face each day with bravery and determination touches everyone around you more than the words can express. You remind us of the power of hope and your journey. Please bring it up, guys, so that I can finish it off. Sorry about that. Yes, there it is. And your journey is a testament to what it means to stay strong even in the hardest moments. Thank you for showing such grace, courage, perseverance. You are truly remarkable. Thank you for that. There is also a comment that we saw that Kimbata Omuhle saying, what you said this morning at church, I see it, Sisi. Indeed, you have witnessed the love of God in your life. Much love and respect to you, Sana Luami. Okay, that's her saying that. I miss Sana Luami. Right. And there's one that says, thank you, Dr. B, and thanks, Sinazo, for the invitation. I will not miss these events again and will sure invite others. Well done, Luvuyo Bayeni Makwande. Thank you very much. And the team is saying at the back, we may need to probably just consider a 30 minutes or so special part 2, so that we will wrap it up. Yes, so we would work on that. And I know my viewers, even one had also said, I think it was Mbata who was saying we must consider extending time. We would have to do a part 2. As we said, we wanted you to feel, to get the experience from a survivor. We'll just end it at the note that will remind you that she went on the 30th of March to do her last chemo. And that meant, and was working in terms of her own journey spiritually. That marks a journey from Easter to Easter. Different years, couple of years in between, but for her, that was the strength that says, in my journey, one thing that I would not overlook is that God has been walking the journey with me. And we would end there for today. We would come back, part 2. The team is saying they are going to work on it, and the Petrenam and his Petanga, but the team has sent some comments that we would work and find time so that we can holistically conclude. But just before we let you go, what would be your closing remarks for today? And especially also taking note that we may need to come back for some other elements or items that we did not touch on for today. But what would be your closing remarks for today? Especially taking note that we are commemorating the International Day for Cancer Survivors.
Know your family history.
Okay.
Know your family history. And we're not just talking about now cancer per se, but know your family history. The illnesses that tend to surround your family. Know the campaign dates so that you can take full advantage of whatever that campaign covers. Because with the likes of cancer, we know that breast cancer is October. In August, there's
the one year.
Yes, lane. So on those months, there's campaigns that are ran, and because they want people to get screening, they run free screenings. And there's also centers where you don't pay the full amount for a screening. For example, there's a cancer center in Pretoria. It runs you pay discounted prices.
The awareness campaigns, yeah.
On the awareness campaigns, it's free. The programs are free. But when you go there on a normal random month, you would not pay the same amount you would at a doctor. So know those things, know where to go, and be self-aware. Don't wait to faint until you know that there's something wrong. Your body will never lie. I will still say your body will never lie. And if it does lie, then you are not paying attention.
You missed the other signs. All right. No, that's it. And that's it from our guest. The team is assuring us that we would have part 2. So that at least we just conclude the topic. But for tonight, let me take this opportunity to thank you. Thank you very much. Thank you for coming through and sharing your experience. And yeah, no,
when it feels good, when you beat this thing, it's almost like, it's equivalent to climbing a Mount Everest if you must.
There you go. Winning feels good. This is yours truly, Dr. Luvuyo Bayeni, your host for DrBTalks. It is now exactly 1919, and I just chose to end at 1919. It sounds better. That it rhymes. So thank you to the viewers for tuning in, and please continue to drop your comments. We would definitely be following up, and they would also form part of our entry or intro for the part 2 session that we will be having. And please don't forget to follow us on DrBTalks page and on Facebook, as well as the YouTube channel, as well as our Sowetan. And thank you very much for always supporting us and being part of this family. And that's it for tonight. Have a blessed day, and thank you very much, and have a lovely evening. We'll meet same time, same place. And please do check on the page the schedule of the topics for the month, and please invite as many people as you can. That's it for tonight. Thank you very much, guys. It has been lovely, and you can still send your hearts, send your thumbs up, thumbs, your claps as we close the show for tonight. Thank you.